So Mallory is a elite level ballet dancer, pre-professional dancer with plans to dance as a career.
I started dancing when I was around 3 years old. I had 2 older sisters who also danced, so I kind of naturally got put into it. I started experiencing a lot of hip pain since probably May of 2019. It was just like a constant pinching basically. It was just a very annoying and irritating feeling. It was painful at times depending on what I was doing, but I continued to dance because it didn't feel like it was anything crazy.
Mallory was particularly having trouble with some of her dance movements that required more than normal hip motion. And so with certain movements, she was having what's called impingement, where there was abnormal contact between the 2 parts of the hip joint, the femur and the acetabulum.
I was like nervous and excited because I wanted to find out what was going on, but I was also like kind of scared that it was going to be something bad.
She had gone through extensive non-operative treatment first, including physical therapy and diagnostic injections, which is typical course for our dancers. Unfortunately, none of those made her better. And so then she was referred to me for evaluation of surgical care. Mallory's condition was unique in that her abnormality of the hip was in the back of the hip joint. So she had more problems with hip extension activities and with external rotation activities. And that area is not as easily accessible through these minimally invasive arthroscopic techniques. One of the things that we're able to do here at Texas Children's as far as offering surgery is we're able to offer surgical techniques that are best suited for each patient.
I immediately went into physical therapy after surgery.
Right after hip surgery, it's really important to get the hip moving in a pain-free way. First, getting the joint moving with easy range of motion exercises, trying to restore mobility to that joint. And then, as the tissue heals, introducing more challenging exercises that strengthen the muscles, and then eventually putting weight through the joint as well.
Keep going, keep going, keep going. Come on, good job. Nice job, Mal. Woo. What did I say, Miss Feeling?
8 weeks she spent on crutches, working just on getting basic range of motion back that a normal person would need. And then after that, working on range of motion that a dancer needs, which is far beyond what normal expectations are.
We had to take care to not put too much pressure on her hip right away and slowly introduce weight through that hip to allow for optimal healing.
When I did start to get walking without anything, I think that was probably a really exciting time. I felt like at that moment it was like actual change was happening. Once I got through that initial moment of oh no, am I gonna be okay? Everything it kind of all started to click. It's been just consistent progress, which is really great to see, and just keeping myself motivated to keep going.
She was an active participant. Worked really hard in physical therapy and took initiative, those kind of things. Those are the patients that you love to see, and those are the ones that you love to help get back to where they want to be.
Here at Texas Children's, we do a really good job of getting to know the athlete, what exactly they're going to have to do, and making sure that we tailor their exercise program and everything we do in PT to maximize their potential.
Mallory is a great example of a motivated patient that found the right place to take care of what she had, and that's why she had such a good outcome.
I expect Mallory's outcome to be like a lot of our patients, which is to get back to 100%.
I think she will easily become a professional dancer and be famous one day and look back and be thankful that we are here for her.
It was quite a journey, but it was, I feel, a necessary journey in my life because it's made me a stronger and better person.